it says, you guys, in the respiratory neck region, the first thing you have to find is the thymus gland. Now, the thymus gland are on the sides of the neck, which pretty much that would be this kind of cottage cheesy light-colored appearance. Looks kind of bumpy. There should be one on each side of the neck. Okay, and it's a lighter color than all the tissue around it. So this is a thymus, this is a thymus. Now, thymus, you guys, what's it do? Nope, that's thyroid. Thymus actually has to do with your fights body with infection because it creates your T cells, your white blood cells, correct. So these are producing white blood cells which fight infection, okay? Then if we keep going down, you have the epiglottis, which we already did earlier. Then it says your trachea. The trachea, you guys, if you go in between your two thymuses and you pull all this tissue to the side, you should see what looks like a white tube that's kind of ringed. Looks like a ringed appearance. This is the trachea. What is the function of this? It's a passageway for air. Why is it ringed in cartilage? So it can't what? Collapse, which means you always have a nice constant airflow. Okay, it won't collapse. Then next thing we need to find is the thyroid gland. Sitting right on top of the trachea should be kind of what looks like the shape of a football almost. Little gland sitting right in the middle. This is the thyroid. It produces a hormone called thyroxine, which means what is it here for? Regulates our what? Metabolism. Excellent. Then if we go up above the trachea, we should see this large swelling in the neck. Okay, this big swollen thing. What is this swollen area called? The larynx. Common name? Voice box. What's in here? Vocal cords, all for making noise, sound production. Correct. Okay. And then the lungs, you guys. All this air passes through the larynx to the trachea. Trachea goes down to the lungs. The lungs are on the sides of the heart. So let me pull this up a little bit. Which means you should see a bunch of lobes of the lung on this side. And then you should see lungs on this side. Now this one obviously injected nice and pink because why would the lungs be so pink? Lots of blood flow because they have to pick up what? Oxygen. So if I were to stab and pin the lungs, what would be the functions?
Respiration.
Which is breathes in O2 and removes CO2. So it's O2 CO2 exchange. Okay? And that's it for that. All right.